Hi, my name is Maliha and I'm a medical school placeholder for the year 2025, which is, after my gap year. And today I wanted to make a really quick video on 3 things that you need to know before you consider applying for medicine. So if you're in the process of, setting up your UCAS, these 3 things are things you need to bear in mind before you click medicine on your application. First one is, if you're going into it for the money, you need to run the other way because medicine is not the way to go for you, my friend, if you are aspiring to be, rich and have a lot of money. Because, first of all, being a junior doctor in the UK, you're not going to earn very much at all. And although one can argue that once you become a fully qualified consultant, like a GP or like a consultant pediatrician or whatever it is, then you will be earning quite a bit, but then you need to consider tax. So when you earn above a certain pay bracket in the UK, you have to pay 40% tax. So if you were earning right towards the upper bracket for many consultants in the UK, which would be around 100 grand a year, you'd be paying 40% tax. So that would be £40,000 in tax, which is a lot of money. So then your take-home pay would only be around £60,000 a year. And then although that seems like a lot, when you deduct things like, if you're raising children, if you're running a family, you're holding down the household, all of that will chip away at that take-home pay, and then you'll be left with a very small amount. So doctors do not earn, they do earn quite a bit, but it is definitely not a career you would want to pursue for the amount of work that you do if you want to be rich, because it's not worth it. If you're literally just going in it for the money, it's not worth it. And to exemplify this point, if you have any doubts, think of it this way: how many doctors and surgeons have you seen driving Ferraris, Bugattis and Lamborghinis? Yeah, not a lot. But if you want to be rich, then the question you need to be asking yourself is, who are the people that are driving Ferraris, Lamborghinis and Bugattis? And then just follow their footsteps. So that would be things that the entrepreneurs, the businessmen, the businesswomen, those kind of people, they're the ones who they go into the more creative routes, the routes in down the pathway of cash flow, the sales industries, the business industries, the corporate world, the business world. Those worlds are where the money is at, not the healthcare world. Bear that in mind before you apply. The second thing you need to consider is just how emotionally taxing medicine can be, when you're actually in the profession, especially if you're in certain specialties such as surgery, pediatrics, obstetrics. I can never say it right. It's obstetrics, right? Obstetrics, yeah. Those kind of specialties can be really emotionally taxing, because obviously you are going to be losing patients at some point during your career. There are going to be patients who die, and those patients may even die under your care, and you may even play a role or a responsibility or influencing that patient's, that patient's loss, that patient's demise. So that is something that you definitely need to be aware of and definitely mentally prepared for, which is the reality of being a doctor, and the fact that you are going to go through very difficult and potentially traumatic experiences, especially if you go into specialties that have high death rates such as A&E and surgery. What you also need to be aware of is, along with those kind of specialties like A&E and surgery, you tend to have very unsociable, long hours, definitely not family friendly. So that is definitely something that you need to bear in mind, and if you're particularly worried about that, then before you go in, make sure you look into specialties that aren't as taxing. For example, dermatology, obviously there isn't as much of a risk of loss of life in dermatology as there is in surgery, if you're worried about losing patients and how that could impact you mentally. And also, I've heard that being a GP is a lot more family friendly than as opposed to going into something like surgery, because obviously surgery is very long hours, whereas GP you have more of a 9-to-5 kind of schedule. The third thing that you need to bear in mind is that the process of learning medicine is very long, which hopefully you may know by now. Basically, to actually study medicine, it can be a 5-year or a 6-year course, even in some cases it's 7 if you're doing a BM6 plus an intercalation year. In addition, once you actually qualify, once you actually graduate from university to become a fully qualified consultant, that will take years. My aunt, she became a GP literally the other day, and she's in her 30s now. So once you actually reach the pinnacle of your career where you have finally stopped the training, it will be years, it will be like a decade, more than a decade. And then even once you qualify, it will be a lifelong learning process, because obviously medicine is constantly advancing, technology is always advancing, so you need to keep up, and obviously you need to be constantly learning and also refreshing your memory, because obviously you need a doctor who knows their stuff. You can't be forgetting stuff like while you're in the doctor's room, because like if people wanted to consult Dr. Google, they would consult Dr. Google at home. They would not come to you for you to then consult Dr. Google. You need to know your stuff. It's a constant learning process, so if you're not the kind of person who likes revision and constant learning and lifelong learning, and you don't see yourself, you know, studying for like the rest of your life, then medicine probably isn't the way to go for you either. But yeah, all that being said and done, medicine is an incredibly rewarding career, obviously, because you are saving lives. It does pay, but obviously, like I said before, it's not something you should go into if you're literally there only for the pay, because obviously I wouldn't want to be treated by a doctor who is just in it for the money. I would want to be treated by a doctor who cares and has a genuine passion, you know, for what they're doing. And yeah, I don't think I have anything left to say. So bye guys, and good luck if you're applying for medicine or whatever you're applying for. You can do this.